know actually we need to understand what are the risk factors that could put us at the risk of having breast cancer. We need to understand what are the ways to prevent this breast cancer, and we need to actually to know how can we detect early breast cancer. Okay? All of you understand? You know English, some English? Yeah, okay. So here we have this picture. This is, we have actually a goal, a vision to achieve the UAE Vision 2021 to reduce cancer deaths. So this is, a goal that we want to achieve. We want to reduce the death from breast cancer. Okay, this is the indicator. This is a national indicator, number of deaths from cancer per 100,000 population. And this is actually, the result for 2018, which is showing that the number of deaths from cancer it is increasing. Okay. What are the most common types of cancer in UAE? Here we have some data showing that, the number of deaths according to that type of cancer, it is mainly from breast cancer, which is, we have 100 cases in 2016 that died from breast cancer. The highest death rate, between the types of cancer. Look at this graph, actually, and we find the age groups that are highly affected with breast cancer, they are 40 to 44, Yeah, if we look at the other countries, we find that, for example, the European countries, other countries, the highest rate of people that get, the age group that mostly are affected and get breast cancer about 50. But in our statistics in UAE, it's showing that, the rate is high with females who are 40 to 40 to 44, even the ages 35 to 39. We have a rate which is not low, So we want to describe, to understand our breast, the structure of our breast, and we want to know what are the warning signs of cancer, and in which area of the breast does breast cancer mainly occur. Here, this is the structure of the breast. Okay, in the breast, what do we have? There are axillary lymph nodes, the green ones, and their function mainly is to filter lymph fluid from the breast. There is, as you see, there is fatty tissue, and there is lobules. The lobules, they are the milk secreting glands, and we have the ducts, the channels that carry the milk. There is the areola, the nipple, and plus in the breast there is fibrous tissue. If you ask me why we need to know this, because according to the structure we can define the types of breast cancer. If the cells arise from the ducts, then this is ductal carcinoma. If the cancer arises from the lobules, then this is lobular carcinoma. Can you catch up with this? So our breast, it is to breastfeed, right? God has created this in us because it has a function. The function of the breast, it is to breastfeed babies, right? Okay. So breast cancer, what do we mean by breast cancer? It is uncontrolled growth of breast cells. Something wrong happened. The cells of the breast, they start to multiply, they start to, grow and multiply in a way which is not controlled, in haphazard way. And we have two types of actually cancer. We have something called ductal carcinoma and lobular carcinoma, according where the cancer has, has arisen or has originated. So what are the things that we need to look for? There are three things that we need to look for, or pre-warning signs that there is something wrong. Either there is change in the breast texture, the way you feel the breast, like if there is a lump, or there is a hard knot, or thickened tissue, or sometimes there is a dimpling or puckered skin. You know, puckered skin is like the skin of the orange, you know. If there is, for example, a change in the skin of the breast, it's more thick. In the nipple, the areola becomes scaly red. Or sometimes there is change in the shape or size of the breast, like swelling or shrinkage, or if there is pain which is not explained, or there is asymmetry in the breast, and if there are changes in the nipple becomes coming, yani it will be inverted. There will be retraction in the nipple. It will go inward. This is a warning sign. Okay? Or sometimes if there is abnormal discharge, if you squeeze the nipple and abnormal discharge comes out of the nipple, could be secretion or could be blood. Also, this could be a sign of breast cancer. So, okay, where does breast cancer most of the time, or which areas in the breast usually breast cancer occur? This is, if we divide the breast, can be divided into 4 areas. This is the upper outer quadrant. This is the upper, internal quadrant, and this is the lower quadrant, lower outer quadrant, and this is the lower inner quadrant. Anyway, okay, in which quadrant or in which area most of the times the breast occur? It occurs in the upper outer quadrant. Okay, in that area. If you ask me why, because this area, it is the most dense area in the breast. But this doesn't mean that breast cancer only occur in this area. 50% of cases occur in this area, but always there is a chance that breast cancer can occur here, or here, or here, or in the nipple, under the nipple area. Okay? So, we need to know, if you ask me why the breast cancer occurs. Actually, we have risk factors, you know, certain, you know, style of living that we do could put us at a risk of breast cancer. Certain, you know, certain factors that we cannot change. We are females. Can we change that we are being females? We are females. God created us as females. Being a female by itself, it's a risk factor. It's the biggest risk factor, actually, okay? Another thing, let us look at these risk factors. Okay, being female, weight gain and obesity. People who are obese, they are overweight. This puts them at risk of breast cancer. Early menarche, getting the period before 12 years of age, or late menopause. You know, getting the period stopping the period will stop at 55 or even later. Sometimes alcohol intake, tobacco smoking, these are risk factors. Explain to them. We have on the other side, if you know the female gets first full-term pregnancy after 30. Family history, especially if you for the first degree relative, if your mother, for example, or sister, they had a breast cancer, this will put you more at risk of having breast cancer. History of breast or ovarian cancer. If before you were affected with breast cancer or ovarian cancer or any other type of cancer, like colon cancer, this could put you more at risk to have breast cancer. Exposure to radiation, okay, and age 50 or over. And as we've seen in UAE, females above 40, not even after 50, they are, you know, developing. There is a high number of females that are getting breast cancer even after 40, not after 50. Exposure to radiation, if a female gets therapy with radiation in one breast, this would put her at risk to develop breast cancer. Okay? Okay, I think I explained this. These are the non-modifiable risk factors, and risk factors that we cannot change, you know. The being a female, as we said, the age, the family history, previous history, genetic factor, early menarche and late menopause, okay? These are the modifiable, which we can modify, you know, we can change. For example, obesity, we can lose weight, right? not practicing exercise is a risk factor, but we can practice exercise and we can change this risk factor. Then breastfeeding, breastfeeding is a good way to prevent breast cancer. Getting the first baby after 30. A married lady, she can plan and have the first baby before 30. We can stop alcohol and smoking, and we can, in case we are working in a place where there is exposure to radiation, we can find measures to minimize this exposure. The stages of breast cancer, and when we decide on the stage, we look for actually three things: the tumor size, the lymph node involvement, and the presence of metastasis. Metastasis meaning that the breast cancer is spreading out of the breast to other organs in the body. And this is, we have different sizes how the tumor will be. This is a size of a pea. This is a size of a peanut, which is 2 centimeter, a walnut 4 centimeter, or it could be 5 centimeter, like a small lemon. Okay? This is the stages. We have 4 stages, of breast cancer. Stage 1, 2, 3, and 4. And why do we need to know these stages? Because, as the stage is more, the chance of survival will be less. Okay? And to decide on the stage, as we said, we need to see how many lymph nodes are involved, the lymph node involvement, and the tumor size itself. Okay? So here we have stage 1. The tumor size is less than 2 centimeters. And it is actually less than the peanut. You remember the peanut? So here, lymph node involvement, there is no lymph node involvement. Going to stage A, stage 2, then the size of the tumor is bigger. It's 2 to 5 centimeters. Okay? Which is the size of the walnut, right? And stage 3, the size of the tumor is bigger. It's becoming more than 5 centimeters, and we have more lymph nodes that are involved. The axillary lymph nodes under your armpit. There are like 4 to 9 axillary nodes involved. Stage 4, this is the stage where the breast cancer, it is coming out of the breast and it's spreading to other areas of the body. Could be to the liver, could be to the skull, could be to the lungs, and this will be very difficult to treat. Okay? This is the stage 1. The tumor, as you see, it is like a peanut. It is small. Fine, and lymph nodes, there is no lymph nodes. Here, the lymph nodes under the axilla, nothing cancer. There is no cancer here. Then, in stage 2, the tumor now is bigger. Okay? Either it could be small with, for example, as we mentioned, 1 to 3 lymph nodes are involved, or it could be larger than 2, but not larger than 5. Between 2 and 5, the size of the tumor. Okay? And the lymph nodes that are involved, they are 1 to 3 lymph nodes involved in the axilla. Okay? This is in stage 2. Either it's stage 2A or stage 2B. Okay? Stage 3, the tumor size, now it's bigger, more than 5 centimeters. We have more lymph nodes involved here now. 4 to 9 lymph nodes could be involved, If we go to stage 3B, the tumor could reach the skin or could reach the chest wall. In 3C, you have 10 or more lymph nodes involved, and the size of the tumor will be bigger than 5 centimeters. Okay? To stage 4, this is very, very dangerous. Why? Because here the tumor could be any size, but if you look at the cancer, it is spreading to other organs, to the lungs, okay, to the brain, to the liver, to the bones. Then we call this metastasis. Why do we need to know about these stages? Well, if I discover the breast cancer at stage 1, then the survival rate, the 5-year breast cancer survival rate will be 98%. I can be cured if I discover it at stage 1. Stage 2, 93%. Stage 3, 72%. Stage 4, 22%. So the rate or the survival rate will be much less when the cancer is discovered at late stages. How can we decrease the chance of having breast cancer? We go back to the risk factors and we try, especially the modifiable risk factor, and we try to change our lifestyle. First one, having the first child before age 30. Second one, we shouldn't eat a lot of fats, Then we have to do sports, like 3 to 4 hours of exercise per week or half of exercise every day. We have to eat like 5 portions of vegetables and fruits. If I am overweight or obese, I need to lose weight. Breastfeeding, it's highly recommended, and we need to take a proper amount of vitamin D, because vitamin D deficiency is a risk for breast cancer. These are healthy foods that it is recommended, like green tea, pomegranate, legumes, whole grain bread, vegetables, and especially the leafy vegetables, broccoli. Okay, these foods are very good it can, prevent breast cancer because it has antioxidants. So, okay, if we look at this, what are the ways we can detect breast cancer early? From 20 years, to start at 20, breast self-examination, we can start at 20 years and then monthly it has to be done. And then mammogram, it has to start at 40 and every 2 years it has to be done. This is here, we have the screening care pathway in UAE, 40 to 69 age. You have to do mammogram every 2 years, okay? So what is breast self-examination? It's examination that usually it's done, you have to do it. And usually we choose a time, it should be on the 6th day after the starting of the period. And if for example, the lady is menopause, which means that she's not getting her period, she stopped having the period, you can choose, for example, a specific day in the month, and every month you choose on that day. For example, the beginning of the month, or it's up to you. This is the instructions how to do breast self-examination. You have the pamphlet with you, okay? How to do breast self-examination. First, you need to look, to observe for changes, okay? And we have a video actually. I will show you the video. Maybe it's easier. What is it?
No, I just didn't have that.
Yeah, okay.
الرأس الذاتي للثدي. الخطوة الأولى: قفي أمام المرآة بعد أن تتجردي من ملابس منطقة الصدر. ضعي ذراعيك على الجانبين. تفحصي وجود أي تغيير في شكل الثدي أو الحلمة أو وجود تغييرات في الجلد عما كان عليه في السابق. الخطوة الثانية: ضعي يديك على منطقة الحوض. مع الضغط قليلا وميلي بجسمك إلى الأمام. هل تشاهدين أي تغييرات في شكل الثدي أو الحلمة؟ الخطوة الثالثة: ضعي يديك خلف رأسك، ثم اخفضي كتفيك للأمام وأيضا شاهدي أي تغييرات في الثدي أو الحلمة. الخطوة الرابعة: افحصي الثديين براحة الأصابع الثلاثة. اضغطي بشكل منتظم وحاولي أن تضغطي كل مساحة الثدي خاصة المنطقة التي خلف الحلمة. الخطوة الخامسة: لا تنسي فحص المنطقة التي تحت الإبط براحة يديك لأنها جزء أساسي من الفحص. الخطوة السادسة: اضغطي الآن على الحلمة ولاحظي وجود أي فرازات خاصة لو كانت مصحوبة بها. وأخيرا استلقي الآن على ظهرك وأعيدي الخطوة رقم 4 وأنت مستلقية، ثم ضعي وسادة تحت الكتف الأيسر ليصبح الثدي مسطحا وسهل الفحص لاكتشاف أي تكتل. وباستعمال اليد اليمنى افحص الثدي الأيسر وكرري الفحص للجهة الثانية بنفس الطريقة. لا تترددي، نحن معك.
Did you understand how she's doing it?
خطوات الفحص الذاتي للثدي. الخطوة الأولى:
Okay, we can explain it.
دكتورة عندنا 5 دقايق بريك ما راح يخلص، إذا تسرعيها ويانا طريقة الفحص.
قد ايه معه؟ 5 دقايق. Okay. So this is how to do the breast self-examination. Okay. We look for the changes like you have seen in the video, okay? And you feel with these 3 fingers, you palpate the area and you use the left hand for the right breast and the right hand for the left breast to see if there is any changes. What are the changes we need to look for? If there is a change in the size or in the contour of the breast, if there is hardness in the breast, the change in the nipple, if it's it's inverted inward, change in the skin, redness, okay, unexplained pain in the breast. If we are going to have a mammogram, as we mentioned, at 40, okay? It's an X-ray that detects any change in the breast, and actually the breast will be compressed with 2 special flaps, you know. It will cause little of pain, some discomfort. And mainly why we are doing it? Because we want to detect any changes in the breast tissue. It's the best screening tool actually for breast cancer. And you know, the test is done like we said, breast self-examination 6-10 days after the first day of the period. On the day you want to do the mammogram, you take a shower and don't put deodorant, perfume, powder, lotion. Better to wear for example, a pant and a t-shirt or a skirt and a t-shirt. It's more practical. And in case you have previous mammogram, you take them with you. Okay? And this is the diagnosis. I will not explain this in the bio. This is how to diagnose breast cancer by doing biopsy. You know, they take sample from the lesion, and they study what are the the tissue. What is this tissue? Okay. They see what is the grade of the cells, and they see if they have receptors of estrogen, if they are positive to estrogen and progesterone receptors. This is biopsy, okay? This is, in case they find something abnormal in the mammogram, the next step what they do, the biopsy to diagnose, and to confirm the diagnosis of cancer. So what are the treatments? Very quickly I will discuss them. Surgery, in case there is a breast cancer, surgery could be total removal of the breast or removing, the lump or part of the breast, for example. And there is the chemotherapy, which is the medication, the drug that they give to destroy the cancer cells, and they prevent that this drug, it prevents the cancer cells from multiplying and from increasing. And the last one is radiation therapy. This is also a method to control and kill malignant cells, and it stops the growth of the cancer cells and tissues. Okay, this is very quickly, okay. So we use actually the radiation therapy. It's adjuvant therapy in case. Sometimes, either with mastectomy or lumpectomy. If they remove part of the breast, it will be with radiation therapy. Sometimes they use the 3 methods of treatment. Sometimes 1 method, only surgery is enough. According to each case, it has, its own. Okay. So we finished actually, and the very important message is that early detection saves lives. When we detect breast cancer at early stages, we save our lives. As you have seen, if we discover the disease at stage 1, then there is a big chance to be full, survival, full recovery from the disease. And the survival rate will be high, and we will save our lives. We have our family that cares for us. This is for us and for our beloved ones, for our children, for our husbands, and for our families. Okay? Because you are important to your family. So we shouldn't be afraid to go and do the mammogram. We have to be brave enough to go and do the mammogram and screen and detect if really we have something abnormal. Because sometimes there are lesions in the breast that we cannot feel it in our hands even. It is detected with the mammogram. Okay? self-examination every month, okay? Don't miss doing this, okay? Any question? Do you have any question? It's clear? Yeah. Good.